depression, listlessness, dejection, hopelessness, inner emptiness. A depression is an emotional malfunction which primarily speaks with emotional dejection, push-down atmosphere, joylessness and a faulty dial mechanism as essential symptoms. In psychiatry, the depression is assigned to the affective malfunctions. The depression is the emotional illness most frequently occurring. This is not only a status of bare sadness but is experiencing all emotions rather reduced strongly. Why many persons affected also report of a status or feeling of the insensibility which is just characteristic for heavy progressive forms. So it comes to an atmosphere limitation at the depression. The persons affected lose the ability for joy or mourning and also lose their affective resonance. This indicates that their atmosphere layer is largely independent of outer influences and it by, for example, also rope general acclaim of the outside or feelings of success cannot be brightened up. If the depression takes difficult forms, this can cause about helplessness, hopelessness, low quality and feelings of guilt that the persons affected find their complete life senseless to itself, which can lead to endangering suicide latently and partly even acutely. At present, you assume generally that a depression was in the game at about 50% of all committed suicides, so a depression is a very serious illness which requires the therapy. Thought circles, or brooding compulsion, timidity, reduced libido, delayed or slowed down intellect, thinking hindering, sensitiveness, tiredness as well as concentration and decision weakness often occur as broader symptoms. Senseless persons affected frequently describe primarily at acute depressions a complete unmotivated awareness. These expresses in such a strong passiveness that they retire from its social environment completely, hardly are able to carry out simple activities like personal hygiene, shop and washing up, and they partly stay almost exclusively in bed for days to themselves. Depressions often lead to physical malfunctions which are called vigorous malfunctions. 2. One then speaks about a somatized depression, loss of weight, hardenings, lack of appetite or excessive appetite, headaches, feelings of vertigo, cardiovascular complaints, for example tachycardia, heart flutter or dyspnea, sleeplessnesses, day tiredness, one and or by sleeplessnesses, weight fluctuations, non-appearance of the menses, are part of the physical malfunctions with women. Vulnerability for infections, strength and sensations of pain without a conspicuous cause, body movement slowed down or on the contrary a reinforced urge to move, inhibited physical expression, reduced facial expression and gestures, and 1. In difficult falls. Depressions also can be accompanied by psychotic symptoms like for example delusions or optical or acoustic hallucinations. A depression which is characterized by a completely unfounded, diseasedly excessive euphoria can proceed unipolarly. There is exclusively a depressive symptoms, or also show a course at which a depressive phase alternates with a manic phase. In this case one speaks about a bipolar malfunction which was described as a manic depressive illness earlier. The exact causes of depressions are not cleared comprehensively yet. A multifactorial cause layer takes a combination of different factors like for example the genetic scheduling, the personality development away for example negative experiences with reference persons and or traumatizations in the childhood and youth and out of such experiences, however, generally on, so, from the person affected the development of negative patterns of thought and with it the education of one premorbid personality. That is one personality who is endangered by its assessment of character to fall ill with a depression in the course of their life. 1. Stress and physical causes, like for example physical illnesses. With regard to the physical causes of depressions there are 2 approaches in the newer research which seem particularly promising for the organic statement of depressions. Some on the one hand, person has shown studies. These are also those fields in the brain which controls the behavior in new situations and at social contacts with depressive people considerably that those regions in the brain which is responsible for the development of destinations and the emergence of positive feelings are less active with depressive people while against this those regions, feelings and fear negative for the emergence are competent, show a more distinctive activity less minted or active as at not under depression suffer. On the other hand, it is regarded as proved meanwhile that, under depression suffer the equilibrium of the neurotransmitters faultily in the brain. These are, what with people and A shows into this that the concentration of the neurotransmitters serotonin and norepinephrine is less than with emotionally healthy persons in the brain of depressive people himself. The site http://www.angst-1-deprive.info writes to this. In depressions, particularly the messenger substances play serotonin and norepinephrine an important forward role. There are these neurotransmitters apparently in the case of illness in too low measure. The nerve cell radios the rope news to the neighboring cell, but simply it does not arrive here because the synaptic gap cannot be overcome. Positive feelings and thoughts do not arrive, so to speak, anymore. Then this precipitates correspondingly in broodings and push-down atmosphere. Antidepressants attack by the way here. Also hormonal causes interrespect, which also can cause a neurotransmitter imbalance. Also count neurotransmitters as one of the substance group of the hormones, come in the area of the physical causes of depressions. Quite harmless triggers can already lead to the emergence of a depression to themselves. The wintertime is in the main trigger for tiredness and depressive malfunctions of the mantle to light. For example, the missing sunshine leads to a malfunction of the melatonin budget. The field secretes this hormone primarily at night. It then serves falling asleep and therefore also is described as a sleep hormone. Within the light poor months, during the day, the field does not reduce the surplus melatonin sufficiently. It is the result of it that one remains tired and dial mechanism poor during the day. 2. The inner watch works no longer properly and the hormonal equilibrium usually existing gets mixed up in the brain. It exactly the other way round behaves as in the case of the melatonin with the neurotransmitter serotonin described as an atmosphere color brightener or luck hormone. Serotonin seems dial mechanism increasing and is just formed increased in the summer months at brightness, and with that, natural sunshine or artificial, very bright light activates the production of serotonin. If the light source is missing, the serotonin production declines. Serotonin is the hormone now which brightens not only the atmosphere of man but controls the bill of exchange of guard duties and sleeping also. However, among other things, the sleep hormone becomes melatonin from this serotonin formed. So if the serotonin production declines, it does not only come to a lack of activity during the day but also to sleeplessnesses. So a hormonal cohesion between malfunctions of the sleep, the inner watch and the break a depression off, added also to itself people recover. If a depression exclusively on lack of light and a malfunction of the insides has clock to be reduced, one speaks about a seasonally addicted depression. Sad. Also physical changes, like for example the menopause, illnesses in the area of the brain or the nervous system, like for example tumors, or malfunctions of the thyroid gland can lead to hormonal malfunctions and with that to the ground loop of a depression. Depressions which are based and do not have any recognizable physical or emotional cause on a change of the brain metabolism and a disequilibrium arising from it of the neurotransmitters in the brain are described as endogenous depressions. This form of the depression is probably based on genetic factors, so is caused hereditarily. Endogenous depressions usually proceed facetly, so start without a recognizable cause and form just by themselves again back. If the depressive phases recur, one speaks about a relapsing depressive malfunction. This more distinctive form of the endogenous depression should be treated. Endogenous depression can unipolarly as, at the beginning, described already, there is exclusively a depressive symptoms, or a bipolar, depressive and manic phases alternate, go and appear also as an involutional melancholia, a milder form of the depression which stops however long and occurs only in the late age. Secondary effects of medicine also can be possible as trigger in the area of the physical causes of a depression. This form of the depression is described as the drug-induced depression and can be actuated by the taking of corticosteroids, antiepileptics, neuroleptics or medicine against high blood pressure, for example. Depressions which occur or are part of whose symptoms in connection with physical illnesses are described as somatogenic depressions. A depression can develop also out of the emotional constitution of a man. Of great importance, the question how a man handles failures, obstacles and setbacks is there. If one frequently experiences, for example, a failure under conditions which one felt or also objectively could not influence, a feeling out of which a depression finally can arise can develop from helplessness. From this, one can, to the opinion, manage to be able to not check the process of the events in which develops, setting that everything which goes wrong, which is a debt of its own, and one can change nothing to this, even if this opinion is completely unfounded in the reality. Possibly, the idea of the learned helplessness is used in the technical language. Errors, one writes frequent failures for himself, on the other hand, under conditions which one thinks to be able to check and own to, even if this does not like to be the fall objectively at all. Can feelings of insufficiency or inferiority adapt what the emergence of a depression favors also in the long run? Depressions which arise out of the emotional structure of a person from malfunctions of either the personality development or how prominent, described as mentioned at the beginning, are described as psychogenic depressions. Depressions also caused by stress have well to be put in order into this group. Psychogenic depressions can as an exhaustion depression one or occur as reactive depression. Neurotic depression arises in the life story context from spiritual conflicts already usually acquired in the childhood or processing defects which is actuated by current circumstances, results from a situation in life which is current and charging heavily, like for example unemployment, death of a close person, or a serious illness of one's own, caused by longer continual one's strong emotional levies. All mentioned causes can occur one by one or also into combination. As executed already, a depression is understood as an event which is multifactorial, therefore caused by several triggers. Still has to be called the depressions. Finally, the appearance is connected to special situations, and these normally form themselves back after overcoming of these situations in life again. The climacteric depression, this is the postpartum depression. As a rule, one occurs in the course of the physical hormonal rearrangement until 2 weeks after the delivery. The age depression, year of life, occurs approximately as of 65th, and the most frequent emotional illness form is in old age, and the depression in the childhood occurs for the first time as of the change of life of the woman and has also predominantly hormonal causes. These forms of the depression cannot be obviously assigned to the somatogenic or psychogenic depressions because they contain elements from the two areas. The postpartum depression and the climacteric depression have, for example, but hormonal, therefore physical triggers. Also emotional offside removing factors within, like for example changes in the couple relation, emotional levies or stress, nevertheless play at the two depression forms. The age depression often arises as a result of the increased appearance of physical restrictions or illnesses in old age, and thus also stands, so to speak, between the somatogenic and the psychogenic depressions. The age physically is indicated by an increased illness vulnerability and relieving mobility, the disconnection from previous life outlines, and the development of dependencies of the environment which were not so existing in the previous life is connected with it desmodromically. The depression in the childhood, which can occur up to the teenager age, also has genetic factors, changes in the course of the physical development, and which particularly changes the brain functions on the path to the puberty. On the one hand physical, and on the other hand emotional causes, difficult demarcation, the setbacks of its own self, esteem related opposite other people or person groups, problems at the establishment in the environment, for example by failure in school, etc. Depressions are distinguished in primary and secondary depressions. At a primary depression, the depression occurs as the real illness. At a secondary depression, the depression is a consequence or a symptom of another primary physical or emotional illness. In the course of her life, about 16 to 20% of all Germans fall ill with a depression, which for the first time most frequently occurs in the age between 18 and 25 years. For the treatment of depressions, the psychotherapy, which can if necessary be connected by antidepressants in contact with the gift, has proved itself. The way of life of one's own also can prevent depressions or help to soothe it. by the consumption of carbohydrates like sugar or crust diameter. For example, the serotonin in the organism at short notice increase. The hormone insulin, which is of not only a great importance in the metabolism of the sugar but which also promotes the admission of the protein module tryptophan to the brain, is provided by the field at the consumption of chocolate. For example, tryptophan is converted into serotonin, which is the reason that the serotonin mirror rises and the atmosphere brightens up. The proverb makes chocolate happy, so have absolutely a truly core. The physical secondary effects of an excessive consumption of sugar are obvious, though, although food also rich in proteins like meat or milk contains tryptophan, it blocks the transport the tryptophan into the brain, however, about other protein modules in turn. As a consequence, the serotonin mirror often even sinks. Motion has the robust path to be increased by the serotonin mirror in the brain. Why stray patients should obtain as much motion as possible with depressions. Physical exercise stimulates the formation of serotonin, endorphins and some other hormones which directly or indirectly positively influence the atmosphere, and also depressive symptoms can let disappear or soothe at least. This effect is also known to athletes and is described as a runner's high. These are a balanced diet and much motion robust agents to prevent actively around depressions or, if necessary, besides a psychotherapy and or a therapy with antidepressants, to help himself at appearance of a depressive illness.